The next exercise is to help build strength in the front of the leg that is down. Using a towel under the knee will help with proprioceptive feedback by pushing into something. Gently press the downward leg into the towel and pull the toes again back towards your nose, feeling the contraction of the front of the leg known as the quadricep muscles. Holding between 5 and 10 seconds, repeating between 5 and 10 repetitions. Modification for the quad set that is supine, lying down, would be seated. Extend one leg, driving the leg down, extending the knee into the ground, again pulling the toes to nose, feeling the front of the leg contract 5 seconds and releasing 5 to 10 times. The straight leg raise is a progression after doing the supine quad set. Again, in the lying down supine position, extend the lower leg up to the height of the opposite bent leg. Maintaining the toes to nose for a better contraction of the front of the leg, pause and return back to neutral. Do this between 5 and 10 times and alternate to the other leg. The seated knee extension can also be used as a modification for the supine straight leg raise previously shown. In the seated position, extend one leg at the knee joint, pulling the toes to the nose, again feeling the contraction of the leg in the front at the quadricep muscle. Pause and return to neutral, repeating 5 to 10 times and doing on both sides. This can be done as an additional exercise as well, or a modification. As progressing, this also may be done with an ankle weight for more resistance. The next progression of lying down exercises is for the gluteal muscles of the side of the hip. Sideline, straight leg raise, raising the leg up. Pause, again keeping the toes to the nose and returning back to neutral. The bottom leg can be placed in a flexed position or extended straight below the top leg as desired and as per comfort. Again, doing between 5 and 10 repetitions per leg. The supine glute set can be done by itself or as a precursor to the supine bent leg quad and glute set. In this position, you simply squeeze the gluteal muscles and contract the quad muscles of the lower leg by squeezing the legs and glutes at the same time, holding between 5 and 10 seconds and releasing. The hip adduction isometrics can be used with a towel or ball, simply placing it between the knees and squeezing the knees together against the resisted towel. Holding for 5 seconds and releasing, repeating 5 to 10 times. Modification to the supine adductor squeeze can be done in a seat, again with some towel and or small ball, squeezing between the knees, holding between 5 and 10 seconds, and then releasing. The supine bridge is used to strengthen the hips and lower back. In a supine position with knees flexed, gently raise the hips off the ground using your abdominal and gluteal muscles. Pause and hold and return back to neutral. Do between 5 and 10 times. This can also be done placing again the towel and or small ball between the knees, squeezing the knees and raising into the bridge position. Pause at the top, again 5 to 10 repetitions with a pause at the top for hold. The standing hamstring curl is done using a chair, the back of a couch, or a kitchen counter for balance. In the standing position, gently raise, bending at the knee with one leg, pulling the heel towards the buttock, pausing at the top and returning back to neutral. Repeating between 5 to 10 times per leg. Do one more rep. The standing squat can also be done using a chair, back of the couch, or a kitchen counter for balance. In the standing position, gently squatting at the knees, allowing the hips to drift back first, keeping the chest high, looking forward. Pause and extend up to standing. Try to maintain the balance through the middle of the foot and or back of the leg, less onto the toes. Go to the depth of tolerance. Do not push through pain. Do between 5 and 10 repetitions, taking breaks at the end of each set.